So today's pharmacies are more than just a place to fill prescriptions. They're a trusted health access point, often one of the most frequent touch points the patient has with the healthcare system. Because now when you are in our pharmacies, they don't refer to it as anything separate. It's one system and it feels seamless. And that's important because pharmacists are busy, and anything we can do to make it easy to engage patients about their own health is going to make us more effective. So we engage people about vaccine gaps or medication use gaps in care, offer a CMR, and all of that is present within workflow in a way that makes it more approachable. So we can be more effective when we make it easier, and that's what the seamless integration has done. But I'd be remiss if I didn't mention that this system has also enabled pharmacists to provide services that advance their scope in states where it's allowed, doing things like test and treatment services for strep, flu, or COVID-19. And to perform those services, to engage patients and support our communities that way has been a big benefit. We have a primary care shortage in America, and patients have trouble accessing that type of care, and it's something that you need very timely. When you're sick, you want to feel better. So having a platform that supports us in documenting those types of services has been a real benefit. So there's ample evidence for the positive impact of pharmacists on patient outcomes, on cost and access. We saw this most recently with COVID as retail pharmacists stepped in to deliver over 40 million vaccinations in a single year. So more and more we're seeing this shift to leverage pharmacies for services like immunizations, medication management, chronic disease monitoring, and screening. Pharmacies are closing care gaps right at the point of care that directly improve STAR measures, HEDIS scores, all while generating new revenue streams, improving patient care and satisfaction. And this impact becomes even more powerful as we layer in nutrition. With integrated nutrition tools like food insecurity screenings, healthy eating assessments, meal planning support, and grocery-based dietitian consults, pharmacists can deliver whole patient care. And because it's embedded in the same workflow, pharmacists and dietitians can collaborate in real time. And it's not just about outcomes. These services foster loyalty, they build brand trust, and they differentiate the pharmacy as a true care destination. Expanding clinical services and nutrition support turns every pharmacy visit into a health opportunity. And AssureCare helps make that transformation scalable and impactful every step of the way.
Anybody that's worked in retail pharmacy knows how many different platforms and systems are available that you might want to use, but they also understand the easier you make it for our pharmacists and technicians to interact with them is critical to success. So when you think about the seamless integration of both our platform and AssureCare, that really is a key enabler to allowing our pharmacists and technicians to have data and insights directly at their hand at all times so that they can help take care of patients the best way.